Aseptic non-touch technique, ANTT, is a form of aseptic technique aimed at preventing infection during clinical procedures. It defines the procedures and measures that must be followed during invasive procedures to prevent the transmission of microorganisms from healthcare workers, medical equipment, or the environment to the patient. There are three main ways contamination of equipment can occur during clinical procedures. First is contact with hands. Second is contact with contaminated objects. Third is airborne contamination. By integrating standard precautions with ANTT, the presence of microorganisms is minimized. The goal of ANTT is asepsis, the absence of harmful microorganisms in quantities that could cause infection. The goal is not a sterile environment, as this is unachievable due to the presence of microorganisms in the surrounding air. It is not simply a clean environment either, as clean refers to visibly spotless or stain-free, but microorganisms are invisible. ANTT protects asepsis through the concept of key parts and key sites. Key parts are components of equipment that can transmit contamination to the patient. An example would be a needleless connector or the tip of a syringe. Key sites are any entry points into the patient's body where microorganisms can enter. An example would be the insertion site for a central venous catheter or the skin over a port before inserting a port needle. The rule is clear. Key parts may only come into contact with other aseptic key parts or key sites. ANTT is divided into standard and surgical variants. Standard ANTT is used for simpler procedures. Key parts are protected individually. It requires a general aseptic field, a microcritical aseptic field, and non-sterile gloves. If direct contact with a key part is necessary, sterile gloves must be used. This technique is, for example, used for the insertion of a peripheral venous catheter or the preparation of intravenous medications. The procedure should last less than 20 minutes. Surgical ANTT is used for more complex procedures. Key parts are protected collectively. This technique includes full barrier precautions such as sterile gloves, gown, head covering, and mouth protection. This technique ensures a safe level of asepsis during surgical procedures. ANTT uses three types of aseptic fields. General aseptic field supports asepsis. Critical aseptic field ensures asepsis. Microcritical aseptic field ensures asepsis on small specific parts of equipment. The practice of ANTT ensures safer care for every patient. By engaging in this clinical practice, you contribute to infection prevention and improving the quality of healthcare.